to everyone that is joining us on behalf of the National Baptist Convention under the leadership of Dr. Jerry Young, the Health Ministry under the leadership of Dr. Michael Miner. I am Nettie Johnson, and I want to welcome you to this conversation on wellness, where we're going to be having a conversation around the COVID crisis here down in Louisiana. And to help with this and to guide this conversation, we actually have a Louisiana health expert and advocate, Dr. Rani Whitfield. Dr. Whitfield, hi, and thank you so much for joining us.
Thank you. I'm excited to be here. I wish we could be in person, but obviously there's some barriers to that right now. So
yeah, we got to obey those barriers, right? And wish more people would.
That's right. Thank goodness, and thank God for the grace He allowed us to do it via virtuality.
Yes, it has been a blessing. The National Baptist Convention has been doing, as I mentioned, our health fair virtually, and it has been very well received. And we're finding that we're reaching people and getting information out in ways that we couldn't otherwise. So we just thank God for the blessing, however it comes around. You know, there's a good lighting in all of this pain. That's right. So for those that may not know Dr. Whitfield, let me tell you a little bit about the person that is going to share with us today. Dr. Rani Whitfield is a board-certified family physician with a certificate of added qualification in sports medicine. He's currently in practice here in Baton Rouge, Louisiana. Dr. Whitfield is a proud output of the HBCU system. He's a graduate of the Southern University. Now, I've learned that I have to say the.
Get it right. Get it right.
I'm going to get it right. The Southern University, that's where he received his bachelor's. And then he completed his medical school training at Meharry Medical College in Nashville, Tennessee. All right, now. He then completed his residency in family medicine at the Franciscan Medical Center in Dayton, Ohio, and his certificate of added qualifications in sports medicine from Ohio State University. As I mentioned earlier, he is in private practice here in Baton Rouge, and he has been a longtime advocate for health in the community, not only here in Louisiana, but across the nation. He's the national spokesperson for the American Heart Association, American Stroke Association here, earning the ASA Southeastern Affiliate Service Award in 2008 and the Stroke Association's Legacy Award in 2009. He's currently a member of the Southern University Board of Supervisors, the Louisiana Governor's Council on Physical Fitness and Sports, and he was recently appointed to Governor John Bel Edwards' Louisiana Health Equity Task Force to address health disparities impacting African Americans. That is so wonderful. Congratulations, Dr. Whitfield. I know they're blessed to have you with that important task. Dr. Whitfield is also known, y'all, as the hip hop doc. He's a musician as well, and he uses music and medicine combined to reach people and to educate our community on health and wellness. And he's not only known here in Louisiana, he's also had national reach as a medical correspondent, contributing to everything from BET's 106 and Park series in the I Village. He was on the Chuck D radio show, Tom Joyner's radio show. He's contributed on there before. He was a medical contributor to AOL Black Voices, Tavis Smiley, the list goes on and on. So he uses his gifts to help people. Dr. Whitfield is a husband and a father of two beautiful children. Just got to meet the little man a second ago on video before we started recording. And he's a life member of Alpha Phi Alpha fraternity. His hobbies include exercise, playing basketball, cooking, and riding a motorcycle, that three-wheeled vehicle called a slingshot. Have mercy. Stay safe.
That's right. Helmets, gotta wear helmets, guys.
Dr. Whitfield, thank you so much for joining us. I'm so glad. And I forgot to say something else. And he's my primary care physician.
I was waiting for that part. Like, you gotta sell it. Tell them the real deal.
I was gonna start it off by saying my doctor's better than yours. Let
them know, man. Let them know.
And we're going to talk about the importance of really having a healthcare team, that as individuals, we have to make sure that we are active in our healthcare, and that the people that are guiding that that they really do truly have our best interests in mind. And I remember when I first got a good job with insurance, and I had a doctor that was just, you know how you just go down the list. They accept my insurance. I picked somebody that was close, and I wasn't happy. And I actually searched out Dr. Whitfield because I think it's important to not only have a good doctor, but have a doctor that does good, a doctor that really cares and has outreach even beyond their patients. And you embody that. So Dr. Whitfield, I am so glad to have you to come and share so people can just kind of hear from you and have you share some things. So one of the things that I wanted to talk about a little bit, and I think that kind of ties into, is the importance of, I think, having a holistic approach when it relates to health. And that's one of the things that you do so often with all of your patients. You talk about how we can own our health, take responsibility for our health, not only with the medication therapies and the treatments and things that are prescribed, but also things that we can do, particularly for those of us that have chronic conditions. Talk to us a little bit about that and about why that is so important that we have a holistic approach as it relates to our health.
Well, first of all, Netta, thank you for the awesome introduction, and we'll just jump right in. I speak often to kids, young people, young adults. Yeah, I've had young folks die from cancers and, again, mostly preventable and treatable diseases, including accidents, homicides, and suicide. So that was what. But I think it's so important that you have a holistic approach and not just focus on after they have the heart attack, after they have the stroke, but try to prevent those things. Many of them did not have those health issues that present to my office on a regular basis. In Louisiana, we have high rates of everything that's bad: obesity, asthma. And so I can do my part. You know, I have my 5 points to healthy living: know your doctor, know your numbers, know your family history, healthy, and exercise. But if you aren't putting that into place, and the only time that you act like or do right is when you come to the doctor's office, then you're wasting both of our times. And I think the reason you and I, as a patient-doctor relationship, have connected so well is because if I ask my patient, Nettie Johnson, to do something or investigate something or research something, she does that. And many of my patients don't own their health. They don't own their health. They just kind of run haphazardly through life. The next thing you know, the heart attack or stroke happens. That's my son. I'm sorry, y'all.
That's quite all right. That's quite all right. That's life. That's future. That's legacy.
That's right.
Now, you mentioned your 5 points. Can you say those again? I want to make sure that everybody gets you. Starts off with know your doctor.
So this is the Dr. Whitfield's patented 5 points to healthy living: know your doctor, know your numbers, know your family history, exercise, and eat healthy. And so that last one, eat healthy, has so many definitions now because everybody's doing something different, some kind of fad. So before you jump on the train of the keto diet or the Atkins diet or all these diets, talk with your doctor to make sure that the things that you're trying to do are right for you. And I'll tell you, I'm a victim of it. And I did the keto with my wife to support her in a sense, and had elevated cholesterol after it because we were doing kind of the not so healthy keto. So I lost weight on it, but my cholesterol went up, and that's not good for my long-term health. So you've got to know what you're doing. And I took a chance, and I kind of knew that it might happen, and not enough vegetables and fruits, then probably your cholesterol is going to rise. So I am a victim of my own mistakes, but I'm willing to admit that and be transparent with your patients as well. And the last thing I want to mention is that the relationship with your doctor is probably the most important before you even start about talking about what's wrong with you. Because if you can't trust your physician, talk to your physician, are you going to lie to your physician? I always tell my patients, if they lie to me, then that means you need to find somebody that you can talk to, because I'm not going to, I can't help you.
That's exactly right. And I love that you start with that. I think that is so incredibly key. A lot of times when we look at African-American health disparities, a lot of attention is often focused on lack of access, not being able, but we see these disproportionate poor health outcomes for people that have access, for people that have the money and have. So this relationship, not only with our doctors, but with the healthcare industry in general. I mean, I think we have some historically inbred distrust of the health system. We have I tend to see this. I actually believe that deep down, if we look at a cultural situation, particularly for African Americans, I think because we've been denied health. And I love how you talked about wellness and wholeness. We've been denied that for such a long time that I think that it's kind of almost part of our culture to not expect good health. And
Right.
so there's this whole aspect where we have to have this culture shift where it's valued and where we realize that doctors are not our enemy or they're going to take something away from us, like I can't eat this, or and that there's this teamwork for us to live well and to live better than some of these low levels that we've gotten so used to.
But
Um,
that we're not that far from the Jim Crow segregated healthcare treatment that was in
yes,
the 40s, 50s, 60s. We're not that far from Henrietta Lacks and the HeLa cells that were stolen. We're not that
yes,
far from the syphilis studies at Tuskegee. There's a really, really great book by Harriet Washington, a physician, that talks about medical apartheid and all of the bizarre and strange treatments. Many of the procedures that I do today to help my patients were done to slaves without anesthesia on inmates. And so even though they're helpful, our ancestors suffered so that we could have medical knowledge at the hands of those that did not care about them. And that's why right now with the pandemic, who we got supposedly representing leadership in our country right now,
help us.
the sentinel moment for us to really take advantage of some things that are happening and the conversations are being had now. So we're not that far from it. And that's why I wasn't alarmed about COVID-19 and the disparities in healthcare when they announced it. Every pandemic, every national disaster exposes the weakness and the fibers of the healthcare of the United States healthcare system. So we saw it during Katrina, we saw it during Rita, we're seeing it now during this pandemic, that there are individuals, Black and brown, that are being neglected, deprived of healthcare. And there's a reason why we have a mistrust of the medical community. And there's still implicit bias. There's studies that have been shown recently where certain doctors, white doctors, will treat African American patients less aggressively later in the stages of disease processes because of the cultural barriers or whatever barriers there might be. Still not quite sure, but they think that we experience pain or have a higher pain threshold than other ethnic groups. So when we come in the emergency room, we're treated less aggressively. So all these things are now coming to light, and now we're having these uncomfortable conversations that needed to have been held, and hopefully something will come out of this positive.
Definitely, definitely. I can see that. I mean, distrust is understandable. It
Right.
is. And at the same time, to advance the health of our people in this nation, there has to be a change in the relationship. That trust has to be restored with the health system and those working in the system. So changes have to happen. I mean, these issues have to be addressed.
Right.
Dr. Whitfield, what are some of the other failings that are harming our community that COVID is spotlighting?
Who's being impacted by COVID-19? The underinsured or uninsured, those that are on the front lines of keeping the grocery stores open, our essential workers, those that keep the pharmacies and doctor's offices open, those that are cleaning in all of the places that have remained open through this. And most of those people look like me. I remember driving to work before doing an interview, just like we're doing now, and someone asked that question. Like, these are the folks that do not have the ability to work from home, do not have the ability or don't have paid time off or sick leave, and are living from paycheck to paycheck. And most of those individuals look like you and I. So what are they doing? They're going to work, probably unmasked, spreading the virus amongst themselves, bringing it home to close quarters. So it's very privileged for us to say that everybody should have a relationship with their doctor, and assume that in other countries there's running water. In some countries they don't have running water, so it's easy for this virus to spread. And COVID is so dangerous because it spreads like the common cold. You and I can both have symptoms, a little cough, sore throat, but we still hanging at the club or whatever we doing and spreading it amongst each other, and you feel fine, and then 6 weeks later in the ICU wondering, where did I get this from? And so we got a lot of stuff. You got to start unpacking all these things that deal with African Americans and why we have these issues. And it's so dismissive and insulting for folks to say that we're lazy and that's the reason why we're infected. There was one senator or representative that said something about us. Maybe we don't wash our hands as well as other folks. And I think in the news, oh my goodness. So it's with a lot of, with COVID came a lot of myths and misconceptions. And so, hopefully we can dispel some of those as we talk as well.
Well, I mean, these inequities are so complex and, gosh, and just entrenched, and they're pervasive and unfortunately protected in some ways. And so as we look at the dismantling that has to happen, and then what our part can be, like how can we be part of the change that we seek? What are some things that we can do both on an individual and a collective basis to, change our
Right.
health outcomes?
Well, let's address those individuals like you and I who are blessed to have insurance, that are working, gainfully employed. I had the ability to work from my office and not touch a patient because of telemedicine. So we have to have some ownership in our health. You have insurance. I have a barber friend of mine that has referred me over 40, 50 patients, guys that have great jobs, good insurance, but just don't go to the doctor because they don't deem it important. And the first thing a black male will tell you is, I got to take care of my family. Well, if you don't have good health and you're not well, then how can you take care of your family? So, annual doctor's checkup at minimum is what you should be doing. But most of my African American patients that he sends to me have hypertension, high cholesterol, have family histories of some heart disease or stroke and diabetes. So for those who are privileged or blessed and have the ability to establish a relationship with a doctor, make sure that you're seeing them and using the insurance that you pay for monthly to take advantage of that stuff. Keep a journal, keep a diary, write your information down and present that to the doctor, just like you do, Nettie, when you come in. Doc, here's my list. Let's go down it. Let's run it. So that's it. For those of us that don't, that's the problem. Yeah, so policy is going to have to really we're going to have to find some, first of all, electing the right folks to get a position that understand the disparities in healthcare and who needs healthcare, and making sure that we have federally qualified health centers in places that are easily accessible, that have hours that are accessible to those that are working 2 and 3 jobs, telemedicine that's available to them, making sure folks have Wi-Fi. There's so many layers to addressing that question. So there's not one perfect answer. Mobile health units, folks that can go to job sites or go to certain neighborhoods and do HIV/AIDS testing, pregnancy testing, counseling, whatever it is that might be needed. So that's going to take some funding from both federal and local government in order to make these things happen, so we can start taking care. But that is a tough question. And again, we've got to find a way to insure these individuals so that they don't have to worry about choosing food over health insurance. And that's a big deal. So it's not an easy answer to that question. There's some folks working on it. It's amazing now that our government is trying to take away Obamacare at a time when many people need it most. And trust me, Obamacare didn't roll out perfectly, but neither did Medicare or Medicaid. And so there was some, but if we were working together, I'm sure we could have gotten it together, but you understand why that's not happening.
Yes, we do. Yes, we do. Continuing on with those in the more vulnerable populations due to
Yes.
socioeconomic reasons, Dr. Whitfield, while this is not always the case, I think that often there are instances where people have needs that relate to health, whether it's access to medical professionals or medical facilities,
Right.
if it's access to healthy foods or knowing about programs, or even just health information, to help them to live well. There are instances where these needs exist and there are resources and helps that are available, but there's this like information gap that people don't know about it and thus they miss out, right?
Oh, without a doubt. And so we got to do a better job of getting the message out. I mean, and that was part of my goal as the hip hop doc. How do you get the message to certain folks? You got to get uncomfortable sometimes. You got to leave your office. You got to use unique ways. So I use social media, my personal Facebook pages to do health messaging, and of course, getting out, going to schools, hospitals, churches, prisons, wherever I can go to get the message out. So sometimes just television is not the route. You got different populations of people. So how do you reach them? You find out how they're accessing the information, and then those are the routes that you use to get it to them.
Yeah, definitely. I think that's
Right.
why hands on and grassroots efforts are often so much more effective because you have to know our people to know how to reach our people. And that starts
Right.
with caring enough to connect,
Totally.
definitely. Now, back to the
Sure.
COVID 19 in specific, you mentioned earlier, this is a novel virus, and so we're still discovering a lot about transmission and morbidity and mortality. And one of the early on findings that was shared very widely on the news is that people who tend to have the poorest outcomes are those with underlying conditions. Can you share and explain a little bit more about underlying conditions, what that is as it relates to us and COVID?
Well, underlying conditions in general are chronic conditions, as we call them, or any condition like hypertension, kidney disease, hypothyroidism, diabetes, that over time a person has for a long period of time, and over time can suppress the immune system. And so who has those most likely in our country? If you look at the numbers, African Americans have higher rates of chronic underlying health conditions. In many cases, sometimes undiagnosed. HIV is one as well. So, if there's 1 million people that are diagnosed with HIV, there's probably another couple million that don't even know they have the disease. And so, again, that speaks back to access, information, resources, and of course, having a physician so that you can be tested, or some type of healthcare services so that you can be tested and screened for those different things, prostate cancer, whatever it might be. And so these chronic underlying conditions, it seems like COVID-19 is targeting individuals that have them, but we're now seeing heart attacks and strokes, what we call pulmonary embolism, which are blood clots in the lung, in younger folks. And so that's why, we're talking about, oh man, when we get to phase 2, and man, when this second phase, we're not out of phase 1 yet. Numbers are spiking around the country in different states. We're not seeing, the death rate has not gone up with the number of spikes, and we're not quite sure why that's happening. But epidemiologists, scientists, and physicians that really study this stuff are very, very nervous about the future. Viruses of this time of year usually tend to slow down because of the heat, the climate, we think, but COVID is not behaving as such. And so, and we're still not testing everybody. So they think that there's many more people that actually have the virus than we're actually diagnosing. And so when it comes back to chronic conditions, African Americans tend to get targeted. And that's, again, we can go back into the history and why these things happen, from the slave diets to what we eat now. And slave diet is now translated into something that's a delicacy. You got soul food restaurants. So we're not eating the way our ancestors did in Africa. We're eating the way we had to eat to learn to survive. But we've turned what was survival food into delicacies now. So, people eat tons of pork and fried food. Heck, we're in Louisiana, you can fry Oreo cookies and they taste like, heaven. But you'll get to heaven a lot sooner if you keep eating them. So, yeah. So we've got to find a way. Again, that's what I said earlier. This COVID has really raised the level of awareness of health in African Americans. So while we're sitting at home and it was unable to go to work, this is a time actually for me where I was actually really more focused in or honed in on my health than I'd ever been. And I work out regularly, but I was able to actually exercise more. Kobe Bryant's death rekindled my passion for basketball. I'm a big basketball fan. So I found some empty courts where nobody was going. And we'll go shoot and do some drills and run just to get out in the air and breathe a little bit. People took quarantine in a little bit the wrong way. Some folks I know literally never left their homes. Quarantining means just to stay away from folks, keeping your distance, wearing masking when you're out in social. But there was a lot of walking and exercising that could have been done without gathering in groups.
Oh goodness, you're talking about food now. That's my thing. You are
Right.
so right. God allowed our ancestors to survive and thrive on scraps. The foods that were really not fit to eat is what we survived on the plantation, but we're off the plantation now and still eating that way, particularly here in the South. And like you said, we call it a hallowed, delicacy. But we can still honor our tradition, but do it in a way that honors the health of our body. So, that's a mission for me. And with exercise, oh my goodness. Now, if anybody has followed Dr. Whitfield's Instagram, if you have not, you need to, especially if you need motivation to work out. Pre-COVID, you would post every day your workout routines, and they were, sometimes I just be like, well, my goodness, they're very convicting as well as motivating. And I know that for a lot of people that maybe had some kind of an exercise routine or regimen, when the COVID and the quarantine hit and they weren't able to go to gyms, or their schedules just changed, for a lot of folks, that kind of gave their fitness a rope-a-dope.
Yeah, I'm getting a whole, doc, I got the pandemic pounds on. It's a PP, the pandemic pounds. And it's like, again, health became a big, like doctors were in, well, we were in right now, it's COVID and how to treat it, and, educating folks on the disease process, but also about how to stay healthy and prevent us, again, from having these chronic conditions. So I'm self-motivated. So it didn't take much for me to say, hey man, look, I got all this stuff in my house, basketballs, bicycles. I'm about to utilize the resources. But there were still tracks that were open, fair use agreements where you can go to different schools, and the tracks open where people can walk your neighborhood. I didn't even know some of the people in my neighborhood that I personally knew lived out here until I started walking through the neighborhood, because it's a typical life. You get up at 5 a.m, you work to 8 o'clock at night, you get home, spend time with family, and repeat that over and over again. So I'm walking the neighborhood now because I got this extra time because our hours were abbreviated, and I'm seeing folks and we're waving across the street. And everybody was out being active. So some of that's self-motivated. It's kind of the same thing. We got to take ownership of our health. We got to take ownership of our exercise and fitness as well. And so utilize this downtime to exercise. You can do body work stuff, push-ups, crunches, planks. Of course, you want to make sure that you're healthy enough to do these things, but there is no excuse for not exercising during this time period. And quarantine did not mean locking yourself in a room and not getting any sunlight and not being outside during healthy sunlight hours. So it's hard, but especially for individuals who need that motivation. I have a personal trainer, but during the time COVID, I wasn't able to go to the gym, obviously. So I found my passion. I went back to shooting basketball, found some empty courts, and would go shoot 100 jump shots and run up and down the court and play Michael Jordan and Kobe Bryant one-on-one in my mind and just have a good time. But, I'm a very analytical guy. That is, I got my fitness watch on. So how many calories did I burn? How long was I out there? So those things are important to me because I want to be around to be able to take care of my families. And I think if we prioritize ourselves, especially from a spiritual perspective, God-fearing man, I pray a lot, and I know that my family's first, but I had to put me before them so that I could continue to take care of them. And so my health is very, very important to me.
Yeah, I mean, we have to remember that self-care isn't selfish, it's essential.
It's not selfish at all. That's right.
That we're to love our neighbors as ourselves. So loving ourselves is a baseline.
Body's a temple. The body's a temple. You take care of that temple. So we only get it one chance. Not, it's not eternal on earth. It'll be eternal later, but it's eternal for right now. So I got to take care of what I can.
Yes, we definitely do. We do. Dr. Google, the Facebook physicians, to our nation's leader that suggested drinking bleach, help us, Lord. There's so much fake news out there related to COVID. Right. Can you clean up one of the more recent things that's going around? It's getting a lot of traction about the dangers of wearing masks.
The only individuals that we're really concerned about wearing face masks are those individuals less than 2 years old and people that can't tell you they need to take their mask off. Now, I tell you, there's some overkill. I see people in the cars with their mask on and nobody's in the car with them. You don't need to wear a mask 24/7, 7 days a week. You wear the mask when you have to be in groups of people around folks. And the main reason for wearing these masks is to prevent you from spreading droplets to other folks. And from the droplets that they when they spit, talk, laugh, cough, sing, spread those to you. And so that's the main reason for wearing masks. There's all kind of theories about 5G and that they're trying to control us and kill us and CO2. False. The only individuals that I'm actually worried about causing hypoxia, low oxygen levels, are individuals who are unable to remove the mask themselves. So children under ages of 2 years old, or those that might have mental health issues or for some reason are physically unable to remove the mask. But it is false. I am not of the belief that this is some new world order. They're trying to kill us all. There's a lot of myths and theories going on out there. This is to protect us. If you notice, years and years ago in other countries, people laugh when they would see somebody from other countries in the airport with a mask on. There's been some studies that have proven that they actually do decrease the risk of exposure and the transmission of different viruses. The N95 means that 95% of the particles, including viruses, cannot get in those masks, and that's where the name comes from. So we were reserving those for healthcare workers, but now some people have found a way to get them since the curve, we didn't really flatten the curve, but since we haven't overstepped the curve and overrode the healthcare system, people can get some of the high-grade masks. But all we're recommending is some kind of face covering. You can take a nice, thick cotton shirt, double it over, put some rubber bands in and create your own mask. Doesn't have to cost anything, stuff you already have at home. How to make your own mask. Yes, go to YouTube, Google how to make a mask, and they'll show you how to do it in no time.
And all the resources out there on Google, it's amazing how many resources are out there, even as it relates to exercise. I mean, there's any kind of exercise that you're thinking about doing or trying to get into some routines, you can find something.
Oh, God, yeah.
As a matter of fact, when the quarantine first happened, I did a post where I was seeing so many things that were coming around, these great resources, most of them free. I posted, 10 quarantine compliant ways that you can work out, and all of them are no cost, and I'll put that up. So there are a ton of really wonderful, helpful resources that are available, and again, most of them are free. Dr. Whitfield, this has been such helpful information and sharing. I want to thank you. And before we close out, I'd like to shift and talk about the other public health crises that is so much in the forefront right now that disproportionately affects African Americans.
Well, America's crisis, I mean, boiling over one to another. I mean, so we got this coronavirus going on, of course. Then we have the George Floyd incident after Ahmaud Arbery, and of course Breonna Taylor. But those got more light once George Floyd was executed on live camera. And so the reason that COVID-19 and George Floyd, Breonna Taylor, Alton Sterling, all these things are linked together is because they're both, in my opinion, public health issues. Um, I think one in every black men and boys can expect to be killed by police in this country. The statistics are really, really shocking and scary. And so you have two public health issues that you're dealing with currently, a pandemic and then the police brutality issue. And that's why you see so much uproar, upheaval. I think because the timing of George Floyd's death, everybody's home, and even those that were working came home to see it, not just on the news network, but on sports news networks, because there was nothing going on, nothing to do. So everybody had an opportunity to see what we've been talking about for many, many years. I just posted this morning on I do have a Black History page on Instagram. I posted about Elijah McClain, who was a young violinist, massage therapist coming home. He had a mask on because he got cold, he had anemia. And cops stopped him and ended up injecting him with an anesthetic called ketamine, and he died. He was brain dead. He died in the hospital. He had no weapon. The person that called 911 said that he looked like he probably wasn't a bad guy, but he probably wasn't a good guy. They couldn't tell, but he didn't have a weapon. But he was, again, an unarmed black man who was killed by police. And so, again, we have these two public health issues going on in the midst of a pandemic with poor leadership in our country and somebody that seems to be fueling the hate. And it's just not a good mix. And so it's a little bit rough to live right now. Now you got the economic crisis on top of all this. And so it's definitely time to be in prayer and talking to your spiritual warriors, because I think we are definitely a spiritual battle.
Yeah, Dr. Whitfield, as you mentioned, we are in a seminal moment in history. I really do believe that as well. I think that in this nation, there's been a level of fed upness reached. We're just fed up. And, the racial inequities are bringing about racial unrest that is manifesting through these very much needed protests that we've been seeing across the nation for several weeks now. And so as we see these needed stands for justice and equality in these protests that are significant size group gatherings happening also during this period of COVID, two issues that both affect the African American community. As someone, a physician that is also very socially conscious and socially active, how is it possible for these two to vie? And if so, how? How can these two come together in a safe way?
Well, there's no guarantee that, because there's no protest that I know that does not violate the rules of social distancing. I mean, we're together, we're in hands, we're in unity, we're shaking hands, we're yelling, we're screaming. And so, there were fears that COVID-19 would spread during the protests, and that may be part of the numbers that we're seeing, and I'm pretty sure that they are. But gatherings can be risky, and that's just the truth of the matter. But it's hard for me, someone who went to protest when Alton Sterling was killed here in my hometown, and also spoke on the steps of the state capitol recently with some pastors about George Floyd and demands that we want from law enforcement, or changes in law enforcement. I participated in these with masks on, but still, it's an intimate setting. And what do Black folks do during times of trouble and turmoil? We come together. And so now you got something that's telling us that we can't come together. We got a pandemic said that we can't come together, support, love, and help and hold on to one another. So not at all would I ever discourage my young people from protesting. I'm older folks that want to get out there and protest. But we've got to wear face coverings, and we've got to change them frequently. We've got to wear eye protection, because you got tear gas, and that can prevent injuries, of course. Staying hydrated, drinking lots of water, keeping bottled water, your own personal water supply with you, bringing hand sanitizer with you. So washing hands is always safe, but in protests, it's going to be hard for you to get to somewhere to wash hands. So keeping tons of hand sanitizer with you, and make sure that the group that you're with is probably the same group, and everybody's using these precautions. So again, sticking to small groups, trying to maintain social distancing. They'll tell you not to yell, but to use signs and noisemakers. But come on, I just know some of those things are not rational or realistic. So ideally, that's what we should do. At minimum, we should have the hand sanitizers, face coverings, and some eye protection to protect yourselves against potential injury. They say we touch our face 20 times a minute or more. So you're out there sweating and you're wiping your face off. So that's why it's good to have the hand sanitizer. But not at all am I discouraging the protests. I think this, again, is a sentinel moment, and we're about to change the narrative of the directive of this country. But all of those things, if you can, do them. But I know in many cases it might not be possible. Other things, too, if you are sick, avoid the protesting and going around people that you could infect. So you definitely got to do that. And then after the protesting are over, wearing face masks around your loved ones that did not participate, and then getting yourself tested as well.
Thank you so much for sharing that. I agree with your position as well. As a matter of fact, my children and I participated in one of the protests out in our town because we just feel like it's important. It is important, and these protests have a purpose, and people are gathering and coming together for a very needed and important cause. And so we just, need to be mindful of the risk and take precautions. So thank you for sharing that information. Dr. Whitfield, what about the gatherings where people are not necessarily coming for the best of, a really serious cause? They're just coming together because they're tired of being home alone and then they want to hang and socialize.
It's just not smart. They had, I forgot what state, it might have been Miami, Florida or somewhere. I mean, people at the pool party just bam, nobody just respecting social distancing, no mask at all. You're drinking, I saw some people smoking cigarettes, which also can weaken the immune system. And so increases your susceptibility to not just, and look, we're talking in a small box. That we ain't talking about the flu virus and other viruses that are out there, other types of pneumonias and HIV from not wearing protection if you're having a protective set. I mean, there's so many other things, just that COVID-19 has overwhelmed us so much that everybody forget that people still die from hypertension, diabetes, high cholesterol. There's so many other things. So we're just talking about one particular virus that's just causing wreaking havoc, but it's wreaking havoc in folks that have other illnesses as well. So yeah, when you see those groups of young folks getting together that might be infected, they got some individuals called super spreaders that once they get infected, they can spread it to many, many people. Whereas some folks don't spread it at all. They're going back to their homes, to their loved ones. So my message to them is that don't just be selfish and think about yourself. Think about those that you love that you may come into contact with, that you could infect with this very deadly virus and take their lives.
Right. Dr. Whitfield, I also think it's important for us to think about the essential workers. Definitely those of you who are in the health profession where your work puts you in close contact with people that are sick. I mean, I get that some of us are tired of COVID quarantine, but I just imagine that you health professionals are tired too, in a very different way.
Tired, but that we signed up for this, and I tell folks all, because I've had folks, and I have maybe I shouldn't admit it, but I just have to admit I have a very low tolerance for folks that are in the healthcare profession that are like, well, I ain't signed up. No, you did sign up for this. Like we knew this theory. They say that what's his name, Bill Gates or whatever, talked about this 2, 3, 4 years ago. But for years, many, many years, it's been theorized that a virus would be something that would take us out. So that's why when people say, well, what do you do in your office different? I ain't doing nothing different other than you having to wear a mask with every patient interaction. But as far as frequent hand washing, making sure my rooms are sterilized, those things my office has to do every day regardless. I don't care if we got COVID-19 or not. And of course, the game is going to be stepped up after this in other offices, but we were doing those things going in because that's what we're trained. People have infections. They bring stuff to the office. It's not like you can turn a person away because they come to the doctor's office. You have to treat and take them. So you have to use those precautions and be safe when you're treating folks. When you're injecting, you're using gloves. You make sure you're sterilizing the skin. Those things don't change. So we signed up for this and understand the anxiety and fear that may come along with it. And some folks may not be as prepared as others. But I didn't say I welcome the challenge, but I mean, I was okay with it. Look, this is what we got to do. How are we going to shift? How are we going to change? How are we going to transition? But that's my job, is to take care of the folks in my community. And you've seen it, Nettie, from just being in the office, but also trying to get the word out about staying home, social distancing, washing your hands, avoiding non-essential travel. Folks just, because they're not seeing their loved one or their neighbor die, they feel like, oh, it's not a big deal. It's like a common cold, it's like the flu. It's not, and we don't know its behavior, so we're still learning and studying and learning more.
Yeah, you mentioned that it is a novel virus, and this is why even things like medical research and elements like that are so important.
Right.
The National Baptist Convention is highly connected with supporting the All of Us research initiative that was started under the Obama administration to have more data on individuals that more reflects the ethnicity and the diversity of the United States. And so, we're still learning, and that's why information changes. But what you just said about you signed up for it, that's why, my doc is better than everybody else's doc.
I don't know about that. Dr. Minor might not agree with that, but we'll see.
Well, let me tell you, I've gotten so many things. So I've heard that first and foremost, we have these 5 tenets that we need to know our doctor, know our numbers. We need to, what's the FH?
Know our family history.
Family history. We need to exercise and eat healthily. You also talked about systematic things that we can do as far as voting. Even the census is important. That even helps.
Oh God, do your census. Please do your census, guys. We got to get our census. They need to know who we are and where we live. So please complete that census.
If we want to matter, we have to count, because the dollars don't follow the need. They're going to follow data. Right.
And Nettie, I did my census on my phone less than 5 minutes. It's not
such an easy process. And for people who don't have smartphones, they can even do it over the regular phone. They can call.
That's right. It's not hard at all.
You also mentioned things that we can do to change our mindset a little bit, to look at what we're eating and exercising, and the fact that sometimes we see what we look for, and there are resources that are available sometimes. And if you don't, by all means, let your needs be known, reach out, and let's try to connect to some things that are happening. But you also drew our attention to some pretty significant systematic inequities that have been for hundreds of years that still have to be addressed. And that ties us back to the voting and to just being aware. It all comes down to the aspect that we have to own our own health and realize that it takes more than just us. This is not something that we can do alone, and that we have to kind of come together and do our part individually and collectively so that we can care for our temples and improve our health in all aspects, in holistic ways.
Right. Well, listen, the only other thing that I didn't add, and at the top of that, and I did tell you that I was a praying man, but without prayer for me, I don't know. This was a tough time, from a financial perspective. My wife had reduced hours, I was carrying a load. And so, and I like to be totally transparent with folks that are listening, because I know this is the National Baptist Convention, and folks, I'm about letting folks know. So everybody was going through something. I think even billionaires struggled a little bit during this time frame. So, this was a tough time for us, I think, but God allows us to be sometimes in these uncomfortable positions to learn. And I learned a lot about myself, my family, and a lot of other things. So I'm appreciative. I even welcome this, because it blessed me in other ways. It made me discover ways to make sure that my family was safe, look at my finances differently, make sure we have enough just in case something like this happens again. We actually refinanced the house right now. The government gave banks money at 0% interest, so we were able to drop our interest rates. But this I welcome the challenges, even from that, because I know God does things or allows things to happen for a reason, and it definitely showed a lot about me and my wherewithal, and we made it through, and we're still, it's one day at a time, but we're making it through. So before I step out that bed every morning, I hit that scripture real good, and then I can get it moving. So
amen. Again, my doctor's better than yours.
Yeah, you better tell them. No, I ain't. I'm just in the building. I'm in the building. That's all. I'm in the building.
Are you accepting new patients?
I am accepting new patients.
You are accepting new patients.
With my new place, I don't have a choice. If you could get on the schedule, you can get on the schedule.
Awesome. And how can people get in contact with you, Dr. Whitfield?
If you want to follow my social media page, and I got to do a shameless plug for my Black History page. I'm at the Hip Hop Doc. That's THA, not the Hip Hop Doc on Instagram. My other Instagram page, we're actually doing a documentary. We're doing a documentary on Alton Sturgeon. I hope I can get back to that. Life Changes. At the day after 2016, and then my Facebook page is just Rani G. Whitfield. RANI Whitfield. So Facebook.com/Rani G. Whitfield.
Okay, I'll be sure to put all of those in the notes. Thank you so incredibly much. I really do appreciate it.